if they weren't able to make it.
Absolutely. So I believe, yes, I think we're recording now. So, okay, from the top then. Okay, so welcome to this ESG-CV Technical Assistance Workshop. Again, the goal is to help you all focus, or to focus on what you all need to ensure that your costs are going to be eligible under the ESG-CV funding, and that you're collecting the right documentation to make sure that you can get reimbursed. And the workshop is aimed at street outreach and rapid rehousing programs in particular. Also, as we go through, if you want to be thinking about what your staff will need to know to sort of implement these programs, and at the end we can talk a little bit, if we have time, about what kind of trainings you might want to set up for your frontline staff. So just a quick couple of ground rules, I guess. Everyone, I think, is on mute, but you should definitely feel free to take yourself off mute if you have questions. You're also welcome to put questions in the chat. We do have a lot to cover today, and so I'm going to try to move quickly. But if I get going too quickly, please don't hesitate to jump in with your questions. And I'm also going to make a point to stop at various points throughout to take questions. So just we can do quick introductions. I think I know many, if not most of you. My name is Julie Lemmer, and I'm with Home Base, which is a technical assistance organization. And I'm joined today by my colleague, Nora Breslin. And just in the interest of time, maybe I think if we want to, maybe let's do an introduction in chat. If everyone wants to put into the chat, let's just say your name, your organization, and maybe just something good that's happened to you this week. Welcome, Sarasa. So we've got Chris Miranda with Community Action Marin, welcome. And Sarasa, you're with Ritter. Haley with St. Vincent. Great, Colleen. That does sound like, yeah, a nice thing to happen, is to have a forced break from work. Zoe, welcome, Downtown Streets team. Colin with Ritter, went to the grocery store first time in 3 months. That's amazing. I don't think I've been to the grocery store in at least that long. Okay, great, Carrie. You got baby's nap scheduled. Okay, great. Thanks, everyone. So just to go over the agenda for today, I'm going to provide just a quick overview of the ESG program in general, and then we'll go through the activities that are eligible under ESG-CV. We'll go through client eligibility and how to document that eligibility. And then we'll just do some general documentation requirements at intake and what's required for ongoing documentation purposes, and then finally, financial record keeping. So we'll go ahead and jump in with a quick overview of the ESG program. I think some of you maybe haven't received ESG funding. So just as a bit of background, there's two types of ESG at this point. There's the annual ESG program, and then there's the what we're calling ESG-CV funding, and that's the ESG-CV is the funding that's been that's come down from the government to respond to coronavirus, and that's the funding you guys are going to be using. So that's what we're going to focus on today. But we'll walk through just a little bit of the program in general to give you some context. So these are the main sources of authority that govern the use of ESG funding. So the McKinney-Vento Homeless Assistance Act, as amended by the Hearth Act, is the legislation that created the COC program, which I think most of you are familiar with. But it also revised the Emergency Shelter Grants Program and renamed it the Emergency Solutions Grant Program, creating the ESG program as we refer to it today. So then the ESG program interim rule focuses on the regulatory implementation of the program, and the defining homeless final rule integrates the regulation for the definition of homeless and the corresponding record keeping requirements that we'll go over in a little bit. And then ESG-CV, as I said, is a separate source that, so the CARES Act made available $4 billion in supplemental ESG funding. So the CARES Act is the Coronavirus Aid, Relief, and Economic Securities Act that was passed in response to the COVID-19 pandemic. And it made available additional funding for grants to respond to the coronavirus crisis. So the main sources of authority for the ESG-CV funds are the CARES Act itself, and then there's a HUD ESG-CV notice and ESG program waivers. And they outline sort of the differences between the annual ESG program and the ESG-CV program. And then finally, there are the HCD notices of funding availability for round 1 and round 2. So in general, the ESG program provides funding for a variety of activities. So, and the reason, just to say, in Marin, the grant is administered through the state. The annual funding is administered through an annual application process. And then the ESG-CV is, the HCD also put out some notices of funding availability for that as well. So, okay, so what can you do with the ESG funding? In general, the funding can be used for street outreach, also to increase and improve emergency shelter options for homeless families and individuals, also to help operate these shelters and provide essential services to shelter residents, for rapid rehousing and for homelessness prevention. And then the ESG-CV, as I said, the CARES Act made additional funding available for grants to respond to COVID. So in addition to using the funds to respond to COVID, the state has identified the following additional priorities for ESG-CV. And that is to provide housing and services that are low barrier and housing first oriented, to rehouse as quickly as possible those experiencing homelessness, and to address racial disproportionality in homeless populations. So again, the goal of this special CV funding is that it be used to quickly and effectively respond to the COVID crisis. So to further that goal, HUD released several rounds of waivers and alternative requirements to make it easier for grantees to use the funds to respond to coronavirus. So I've outlined a few of these on this slide. So just generally, there's no match requirements for the CV funding. There's no caps on emergency shelter or street outreach. The notice waives FMR limits, although units still have to meet the reasonableness standards, and we'll talk a little bit more about that in a bit. It also waives, so there's in the annuals ESG, there's a case management requirement that case managers meet at least once a month with each program participant. And that requirement has also been waived for the duration of the COVID crisis. And then another difference is the rental assistance limitation. So for purposes of the ESG-CV funding that we're using here, it defines medium-term assistance as more than 3 months, but not more than 12 months. So for annual ESG, it's 24 months. But this alternative requirement, the stated purpose is that it'll allow more households to receive assistance more quickly, which is necessary to respond to coronavirus. And then finally, there's an expansion of Category 1 definition of homelessness, which we are going to talk about a little bit later. And then just to run through, there are some general requirements for all ESG funded programs. And one is that programs are required to enter participants into HMIS, with the exception of DV providers, domestic violence providers. And I think your staff has had their trainings on this HMIS entry already, so that's good. Programs are required to submit to annual monitoring by the COC. And to align with Housing First principles to ensure low barrier, easily accessible assistance to all people, including those with no income or income history and those with active substance abuse or mental health issues. And this is outlined a little bit more in the Marin COC written standards. There's also a duplication of benefits requirement that we're still waiting on more guidance from HUD regarding duplication of benefits and how it will, how programs should address it. But for purposes of today, I'll just say that the requirement is that a recipient that receives ESG-CV assistance has to be able to demonstrate that they're not receiving duplicative assistance from another source for the same cost. So it may just entail asking questions during the intake process about whether the client is receiving other sources of assistance. But basically, if you're assisting a client with ESG-CV, you just want to make sure that you're not using a duplicative source of funding for that same cost.
Hey, Julie, there's a question in the chat from Colin who says, is there any kind of requirement related to case management, such as once every 60 days or something along those lines? I'm happy to answer that if you want me to, actually.
Sure, go ahead.
Yeah, Colin, great question. So under this annual ESG program, there was a case management requirement or housing stability case management requirement of, I believe, every 3 months. But that's been waived by the ESG-CV notice that Julie was mentioning. So it's sort of as appropriate and as needed, because I think HUD and HCD understand that that during COVID, there are some challenges with case management. So I think as a best practice, best to do it as often as the client needs, but in terms of the program, the funding requirements, they've been waived for the CV funds.
Good question, and thank you, Nora, for responding. Okay, and then finally, we'll talk a little bit more about financial records and reporting as well. Yeah, okay. So is everyone still with me? Any questions at this point other than Colin's? Okay. So we'll start to move on now into the pieces that are going to be most directly relevant to you all and the work that you're going to be doing with this funding. So we'll start with looking at the various street outreach and rapid rehousing activities that are eligible for funding under the CV program. So for street outreach, here's a little outline of the costs that are eligible. So engagement means the costs to engage. So to locate, identify, and build relationships with unsheltered folks and to connect them with homeless assistance. So these activities are things like making an initial assessment of needs and eligibility, crisis counseling, addressing urgent physical needs, so providing meals, blankets, clothes, toiletries, etc., and then actively connecting and providing information and referrals to programs targeted to homeless folks and to and connecting them to mainstream social services as well. Case management are the costs associated with assessing housing and service needs, arranging and coordinating the delivery of individualized services, documenting eligibility, providing counseling, and providing, and coordinating services, monitoring programs, developing housing plans, those types of things. The eligible costs for emergency health and mental health services are the direct outpatient treatment of medical conditions, which would be provided by licensed medical professionals operating in the street setting, anywhere homeless people are living. So the streets, encampments, those types of places. Transportation, so that's the cost of travel by outreach workers, social workers, the medical professionals. And this includes the cost of transporting unsheltered folks to emergency shelters or other service facilities, the cost of the participants' travel on public transit, a mileage allowance for social workers to visit program participants, purchasing or leasing a vehicle for staff use in conducting outreach activities, and this would include the cost of gas, insurance, taxes, and maintenance on the vehicle. and then the cost of staff to accompany or assist participants to use public transportation. And then finally, services for special populations is one of the categories listed in the regulations, and it's the costs of otherwise eligible street outreach services that have been tailored to address the needs of homeless youth, the victims of domestic violence, and or people living with HIV/AIDS who are literally homeless. So those are some examples of special populations. So these are the sort of generally eligible activities under street outreach, but for ESG-CV, there are a few additional activities that are also eligible for this funding. So the costs of installing and maintaining hand washing stations and bathrooms, so basically just porta potties and hand washing stations, are also eligible costs. You can provide volunteer incentives. So basically the costs of providing reasonable incentives to volunteers, and these can be gift cards or the like. And the idea again is to try to incentivize people to do this work, more people to do the work more quickly. And then training. So if you're doing training on infectious disease prevention and mitigation for staff who are working directly with those who are homeless, you can charge this against the ESG-CV and it's not considered administrative costs. Okay. So moving on to rapid rehousing eligible activities. So the rapid rehousing eligible costs fall generally into one of these three buckets. So we've got rental assistance, financial assistance, and services, and I'll go through each of these. So under rental assistance, the funds can be used to provide short-term rental assistance, which is that considered up to 3 months, and medium-term rental assistance, which would be 3 to 12 months under the ESG-CV. And then rental arrears. So this can be a one-time payment of up to 6 months of rent in arrears, and that can include late fees on the arrears. And just to note that the amount of ESG funds spent on rental assistance for a particular unit is capped at the rent reasonableness standard. So that's the case even if the rent reasonableness standard exceeds the fair market rental. So, and that's something that's a little bit different here from annual ESG. So you're capped at rent reasonableness. And I am gonna talk a little bit more about rent reasonableness in a bit here. So our second bucket is financial assistance. So in addition to rental assistance, ESG-CV can be used for these additional costs. So you can use it to pay for rental application fees that are charged by the landlord to all applicants. You can use it to pay for the security deposit as long as the security deposit doesn't exceed 2 months rent. Although, well, we'll talk a little bit more about landlord incentives in a bit, which addresses this too. You can use it to pay utility deposits. So sometimes utility companies require deposits for customers. You can use the ESG funds for those deposits. And you can also use it to pay for up to 24 months of utility payments. And that also will include, you can pay for up to 6 months of utility payments in arrears. So utility deposits, utility payments, and utility arrears for up to 6 months. And this applies to gas, electric, water, and sewage. You can use the funds to pay for moving costs, so truck rental or hiring a moving company. And you can use it for temporary storage fees for up to 3 months. So, but for the temporary storage fees, you can pay for up to 3 months of temporary storage fees, but any arrears in this category are not eligible. And then finally, if a program participant receiving rental assistance meets the conditions for an emergency transfer, funds can be used to pay amounts owed for breaking a lease in order to effect that emergency transfer. Okay, and then moving on to the third bucket, which is services. ESG funded support services. So the eligible services are also outlined in the regulations, and they include, so housing search and placement. You can use the funds to assist in finding and retaining suitable housing. And these are things like housing searches, tenant counseling, the arranging for utilities, making moving arrangements, developing an action plan for locating housing, and then also outreach to and negotiation with landlords. So also housing stability case management. So programs receiving rapid rehousing assistance must develop a plan to assist the participant to retain permanent housing after the ESG assistance ends. And this is, developing a housing stability case management plan to do that. And this is where a meeting with the case manager is required under the annual ESG program. And it's actually a once a month requirement. But again, as we've said, this once a month requirement is waived during the COVID crisis, and the guidance is just on an as needed basis. So it's good practice to meet as often, but the once a month requirement is currently waived. ESG funds can be used to pay for mediation between the participant and the landlord. And also, so it's between the participant and the landlord, or also you can use it to fund mediation between the participant and anyone with whom the participant is living. So any mediation that's necessary to prevent the participant from losing permanent housing. You can use the funds to address legal issues that prohibit a participant from obtaining or retaining permanent housing. So this would include preparing the case for trial if necessary, providing legal advice, representation at hearings, filing fees and other necessary court costs. Again, if it's an issue that would prevent the participant from retaining their housing. And then ESG funds can be used to pay for credit repair costs, including credit counseling, access to a personal credit report, resolving personal credit issues, and any other services needed to assist with skills related to budgeting and money management. So those are the three main buckets. And then for ESG-CV, again, we have these additional activities. So hazard pay, ESG funds can be used to provide hazard pay to staff that are coming into proximity with people that have COVID or who are working in locations where they have a high likelihood of contracting COVID. And as I mentioned, you can use the funding to provide landlord incentives. So these can be things like signing bonuses that can be up to 2 months of rent, security deposit equal of up to 3 months of rent. You can use the money to pay costs, the costs of repairing damages incurred by the participant that are not covered by the security deposit, or if they're damages that are incurred while the participant is still in the unit. And then also paying the costs of any extra cleaning or maintenance that's required. But there is, I did want to also note that the landlord incentive, there's a cap that you cannot use the funds to pay an amount that would exceed 3 times the rent charged for the unit. Okay. And then just as with street outreach, and you can use the funds to provide volunteer incentives and training on infectious disease prevention and mitigation. Okay, so I am going to pause here for questions. Are there any questions on eligible activities for either street outreach or rapid rehousing?
I had a couple just clarifying questions. For the credit repair, we can only use that funding to refer them to credit repair counselors. We can't actually pay off any of their debt related to their credit. Is that correct?
Yeah, I believe that's correct. Nora will correct me if I'm wrong, but I'm sure. Yeah,
that's correct. It's just the cost to have them work on repairing their credit, but it specifically says in the interim rule that it can't be used to pay off delinquent debt.
Okay. And then for the landlord incentives, I know like before it was like we can't do more than 2 months of a deposit, but then here it says up to 3 months of a deposit. So is it like the security deposit should only be 2 months, but then we can add another month as an incentive and those would be tracked differently?
I believe that's right, Haley. So actually, Nora, do you?
You wouldn't want to call it a deposit payment, because if it's a deposit payment, legally it can't exceed 2 months of someone's rent. So I think it's a financial question that, and I was kind of wondering the same thing as Haley, like how do you financially, like how would we work with our financial teams to help them track that and allocate that? Like, okay, here's like what would you call it, I guess, in terms of the incentive?
Yeah, it's a really good question. So my understanding is that the state law is that, I think this is what you're referring to, Colin, is up to 1.5 times the rent, or a monthly rent is the max security deposit that you can charge. I could be, I'm not an expert in state law, so I could be wrong on that, but my suggestion would be to do anything above what the legal amount is as an incentive, because that's the way it's described in the CV notice. So you could even say that the entire, I think that the way it's phrased in the notice is a little bit confusing, but I would say, you know, we're going to give the landlord 1 month of security deposit, and then as an incentive, maybe as a signing bonus, or listing it in your internal financial documents as an incentive for the rest. That makes sense. Not to make it, say one more thing to make it even more confusing, but I think the reason why they have it, why it's a little confusing, is because you just want to make sure that the total incentive amount isn't more than 3 times the rent.
Yeah, I think this is also just a matter of like a national program and local state regulations. Like you can do a 3-month security deposit in a state that doesn't have a limit on security deposits. So you are still bound by state law too.
Haley, did you have any other questions, or anyone else?
All right now, thank you.
I guess, would you want to do like 2 separate checks?
That would probably be safest.
Yeah, that's what I would do.
Okay. Thanks. That's a sticky one.
Okay, well, if there are no more, and you guys can always, we'll give you our contact information at the end, and you can always reach out with more questions. But so, okay, now we've gone over what you can use the money to do. So now we'll talk about who is eligible to be served by these funds. So just to give you a little bit of background, there are 4 categories of homelessness that are recognized by HUD. Categories 2 and 3 aren't applicable here, so we won't really talk about those. We're going to focus on categories 1 and 4, so literally homeless and fleeing domestic violence. So just to start, the program types, there's different eligibility for program types. So under street outreach, you can serve anyone who is literally homeless as defined under category 1. And again, we'll go through those definitions in just a minute. Rapid rehousing programs are also eligible to serve anyone who is category 1 literally homeless. But there's also an extra they added in that you can also serve anyone who is in category 4, who's fleeing domestic violence. But there's a caveat that the category 4 person also has to be literally homeless. So the takeaway basically is that the eligible population for both programs has to be literally homeless. So let's take a look at what the definition for literally homeless is. So HUD defines literal homelessness as a household that lacks a fixed, regular, and adequate nighttime residence. This would include, they divide it into kind of 3 separate subcategories here. So sleeping in a place, private or public, that is not meant for human habitation. So this would be like sleeping in the street, in a tent in the park, in a car, or an abandoned building. And an RV also applies under this category so long as it's not connected to any utilities. The second sort of subcategory is someone who's residing in a shelter. So a shelter designated to provide temporary living arrangements. So this could be an emergency shelter. It could be a hotel paid for by housing providers. And then the third category is someone who meets either of the first two. So they're literally homeless, living in a shelter or a place not meant for human habitation. Then they entered an institution such as like a jail or a hospital. And then they were released within 90 days and are now homeless again. So basically that's like someone who was homeless, went to jail or into the hospital, came back out before 90 days was up and is now homeless again and presenting at your program. So you'll see here, we have 90 days crossed out and 120 days put in there because one of the waivers does alter this requirement and makes it 120 days. So you could have been in jail or in the hospital for up to 120 days and still qualify as literally homeless. But I'm not sure, this waiver is set to expire at the end of this month. So I'm not sure how many of your clients this will apply to. But just for purposes of today, just know that it's usually 90 days. There's a waiver that makes it 120 days that only lasts until March 30th. And then one last note, so literal homelessness would not include things like couch surfing, people who are doubling up, sober living homes, or a motel that is paid for by the client themselves. Okay. So let's do just a little hypothetical here, just so you can kind of get a feel for how this works. So we have Lily. Lily presents at your program. 6 months ago, she entered a mental health hospital because she was experiencing delusions. She gets out of the hospital today. And before entering the hospital, she was camping in a wooded area because she had nowhere else to stay. So does Lily fall into category 1? What do you guys think? I see Colin shaking his head. Anyone else? Okay. Colin, you're right. So she, whoops, I guess I didn't put the answer on a slide, but I'll tell you what it is. So no, she has not been in an institution for more than, or she has been in an institution for more than 90 days and actually more than 120 days. So otherwise she would be eligible because she was literally homeless. She was camping, which is one of the places not meant for human habitation under the definition. And then she entered an institution and was released again and is homeless. But unfortunately, under this hypothetical, her stay at the hospital was too long. So if she'd been there less than 90 days, she would be literally homeless. Any questions about that? Great. Okay, so we'll talk a little bit about category 4. Just so the definition is an individual or family that's fleeing domestic violence and has nowhere else to go and has no support network. So this is, because rapid rehousing is eligible to serve category 4, we include this definition here, but I just want to remind you and make clear that even eligibility for category 4 under rapid rehousing for ESG-CV still requires that the client also be literally homeless. So you still have to meet the standards we just talked about under category 1. All right. So again, just any questions on this, on eligibility?
I'm just trying to remember, like, for someone like Lily, how long after exiting the institution? It's just a day, right, after exiting the institution that she would then become literally homeless again, right? Like
Yeah.
1 day in a shelter or, okay.
That's right. I think the idea is she comes out of the institution and has nowhere else to go, or shelter, or literally homeless. Okay.
You just can't do the thing that really makes a lot of sense, like help them go from the institution directly into housing. Yeah.
Okay. Okay. Now that we are all experts on eligibility, let's talk about how we document the eligibility. So the reason it's important to document it is that it needs to be documented to be reimbursable. So we'll just go through, first, so start with street outreach. So, because street outreach is actually a little bit simpler than rapid rehousing. So basically, street outreach programs can document homeless status by self-certification by the person or the head of household who is seeking assistance. So this can be pretty simple. A lot of outreach workers will use a sign-in sheet that sort of indicates that if you sign this, you're certifying that you lack basically the definition of literal homeless. You're certifying that you lack a regular nighttime residence and are living in a place not meant for human habitation, excuse me, or in an emergency shelter. So this is, and it makes sense because if you're doing street outreach, you're not going to be able to find a bunch of, before you engage with the client, you don't want to have to find a bunch of the paperwork that you're going to need when you get them into rapid rehousing. So eligibility for rapid rehousing is a little bit more complicated. And I know there's a lot on this slide. It's very busy, but I just want to make a note on the order of priority for obtaining evidence. And I've tried to, I don't know if you can see it very clearly, but I've tried to delineate it with the color, a bit of color coding here. So the dark blue is third-party documentation. And this is third-party documentation is always the best. This includes things like HMIS records, referrals from third-party providers, or observations by third-party providers or even community members that are reduced to writing. Second best is second-party documentation. So this is where your intake worker, basically they're not able to obtain the third-party documentation, and so they certify their own observations. And then an important component to this piece is to explain attempts. So you want to document your attempts to secure third-party documentation, why it wasn't available. And then finally in light blue is just client self-certification. So if neither third-party or second-party evidence is obtainable, the client can self-certify. But again, you want to document any attempts made to secure third-party documentation and explain why it wasn't obtainable. And then again, just to be clear, this is the sort of the general requirements for documenting these 3 different types of literal homelessness. But there is an exception for street outreach that we just talked about. And just so you know, HUD does make it very clear that under no circumstances can the lack of third-party documentation prevent someone experiencing homelessness from being immediately admitted to emergency shelter or from receiving street outreach services. So, but getting back to rapid rehousing specifically, so for each of these subcategories of literal homelessness, these are the items that you would need to document each of them. So third-party verification of the conditions where the individual or family was living. Again, this could be HMIS records of shelter stays or of street outreach contacts. It could be written referrals from third-party providers or written observations by street outreach or a community member saying, hey, I saw this person was living in a place not meant for human habitation. And then if you can't get third-party verification, your staff can certify in writing their observations of living conditions. And again, just make sure they document all attempts to secure that third-party documentation and why they couldn't get it. And then finally, self-certification by the individual. And then for the third subcategory of institutions, if the person was in an institution, you'll also need one of the additional documentation sources that I've got listed here. So discharge paperwork from the institution, obviously would be best. And then written or oral referral from the social worker, case manager, other official from the institution. That includes the start and end dates of their residency. And then if neither of those is obtainable, if you can get make a written record of the intake worker's due diligence in obtaining that evidence, plus self-certification by the individual that states that they are exiting or have just exited an institution and they resided there for 90 days or fewer, again, or 120 days, depending on the date. Okay, so I do have, first of all, any questions on documenting category 1?
I have a question. So where and how do we keep this documentation? Like, for example, if there's an HMIS record of street outreach, do we need to like print that note and upload it into their rapid rehousing HMIS profile? Or can we just say, okay, it's in HMIS, they're good to go?
So Nora, maybe you could speak to the best practices since.
Yeah, so I never want to encourage a paper file, but I would say we do a lot of like auditing and monitoring of different rapid rehousing programs. We as Homebase do that. And typically I would say most people will have a paper file that has all of the requirements documentation that we're talking about today. Absolutely doesn't have to be paper. Obviously it could be online if that's something you have the capability to do, or like a digital file. But you just need to make sure that like if HUD comes in and audits you, that they have access to see that HMIS record and that you checked to make sure that there was third-party verification that person was literally homeless.
Okay. Can that digital file be kept in HMIS? So like when we enroll them in the ESG program in HMIS, we can upload it into that files section?
I think that my suggestion is always, you want to be able to show HUD or HCD or whoever's auditing the program, if that were to ever happen, that you're in full compliance. So I would say make that information accessible to them in whatever way is going to be easiest for them. So I think sometimes, I don't think we often see people just keep it in HMIS because that can be hard and there can potentially be some privacy concerns about third parties accessing that. So I would say, yeah, keeping a separate digital file with all of the documents we're going to talk about today that meet these requirements is probably a better practice.
Okay, thank you.
Thanks, Nora, and thanks for the question, Haley. Any other questions? So I'll move on. We've got a little hypothetical going back to Lily. So let's say this time Lily's actually only been in the hospital for 2 months. So now she is eligible under category 1 literal homelessness. So she presents at your program. What documentation would the case manager need to provide to show that she meets the standards of category 1? Anyone want to take a stab? What would you want to collect? Okay, so maybe you guys are just shy.
The paperwork from the institution.
Right. Okay, right. You definitely discharge paperwork from the institution.
You want that documentation of literal homelessness from before she entered. So ideally like an outreach worker record.
Right.
That
Thanks.
could-
Okay, so the two of you together, you got it. So you would want the documentation of her being literally homeless. So either the HMIS record of street outreach contacts, or you can get a written observation from the street outreach worker, or even a community member saying, stating the conditions she was living in. Or if you can't get that, then a written referral by another housing or service provider, or even self-certification by Lily. But since Lily was in an institution, as Teresa pointed out, you also would need either discharge paperwork from the institution, or you'd want the referral from the social worker, case manager, or whoever, wherever she was discharged from, that includes the start and end dates of her residency. And then again, if you can't get either of those, then you can just document your due diligence in obtaining the evidence and get Lily to self-certify. Great. Any questions? Oh, and then, okay, so, and then for documenting category 4, so this is fleeing domestic violence. So the eligibility for category 4 should be documented by an oral statement by the individual or head of household stating that they're fleeing. So, and again, this statement can be documented by either self-certification or by the caseworker. And then self-certification that no subsequent residence has been identified, and self-certification or other written documentation that they lack financial resources and support networks to obtain other permanent housing. But again, if you're serving category 4, they still need to meet the requirements for category 1, and category 1 also needs to be documented. So that is documenting client eligibility. And if are no questions, we can move on to sort of more general programmatic documentation, what you need to have for clients, but also we'll talk about a little bit about like financial and other things as well. So to start with the documentation at intake, here's a checklist kind of the things you need to collect and keep in your files. So documentation of homelessness, which is what we just talked about. And then the HMIS releases of information. And I think this was part of the HMIS training that your staff got last week or the week before. So I think, Carrie, is it right that in Marin there's a release of information on through in HMIS that they can?
Yeah, and just in case people are like, what HMIS training are you talking about? We weren't at that. That was, we did a HMIS training for outreach, since we haven't had outreach programs. For rapid rehousing, the HMIS is going to be like, you guys have done rapid rehousing program, so it's the same process. But yeah, we have an HMIS release of information.
Right. Okay, and then rent reasonableness, you'll want to document that. And again, we'll come back to that in just a second, talk about what that means and how you do it. You also want to have your rental assistance agreement in the file. So under the regulations, you can only make rental assistance payments to an owner with whom you've entered into a rental assistance agreement. So the rental assistance agreement will provide that during the term of the agreement, the owner, the main provision is that the owner has to agree that they're going to include the program on any notice to the program participant. So if they're giving notice to the program participant to vacate, or if they're going to be starting an eviction action, you want to make sure they're giving you notice of that. But you'll want a copy of that in your file, a copy of the lease. So each program participant that receives rental assistance must have a legally binding and written lease. The only exception is if the assistance is only for rental arrears, then an oral agreement is fine. But you will want to make sure that the arrears, the amount of the rent, the back rent that's owed, is also documented. And then just a note, the lease has to be between the landlord and the program participant. And then the last few, the VAWA addenda, lead-based paint disclosures and habitability standards. These are just standard forms for certifying disclosures and confirming that applicable standards are met. I'm not going to go through the specifics of these, but I'm pretty sure you can find these forms online, but we can also, if you need them, Homebase can direct you to copies. And then, before we move on, I just wanted to make a note that for participants receiving ESG rental assistance, you don't have to do an income assessment at the initial evaluation. So the income assessment will be done at reevaluation, which has to take place once annually for rapid rehousing. And then for eligibility at that point, the participant's household will have to show an annual income that doesn't exceed 30% of the AMI. But just note for now that there is no income assessment required at the initial evaluation.
Can I add one thing, Julie? And
Yes.
you're probably just about to say this, and I'm depriving you of the opportunity. But
Go ahead.
so I think that's like a big point of confusion for ESG recipients, because you do need to assess the client's income at intake, but it's really only for the purposes of calculating what their rent contribution might be. And it doesn't go to an income eligibility requirement for rapid rehousing. Does that make sense? Okay. Thanks, Julie. Sorry to jump in.
No, thanks, Nora. Thanks for clarifying. Okay. So just to touch on rent reasonableness, we've been talking about this a little bit. So this is a departure from the annual ESG program. The CV funds are capped at rent reasonableness, and this is even if the amount exceeds the FMR. So in other words, the amount expended on rental assistance is not capped at FMR. So what rent reasonableness means is the idea is to ensure fairness and prevent inflation. So the rent reasonableness is basically it's reasonable as compared to that paid for private units that are in a similar location, of similar size, quality, age, and that offer similar amenities and utilities. So the way to determine rent reasonableness is, so a market study of rent charge, this can be as simple as looking at comparable rentals on Craigslist. And I think a good practice is to, look at three or so, and then you may want to print those out and, or save them to a PDF, digital file, whatever. So in order to keep that, because you want to keep this documented, of course, how you determine rent reasonableness. So you can determine it via a market study of rents charged, a review of advertisements for comparable units, or you can get written verification from a property owner or management company. But again, this has to be documented, so just be sure to save the materials that you review that are the basis for your rent reasonableness. Okay, and then just a second checklist for ongoing documentation. So in addition to what you need to keep at intake, you also want to document the services and assistance that you're providing on an ongoing basis. So you want to keep records of the types of services, the rental assistance, utility payments, stabilization and relocation services, whatever you're providing under the program. You want to keep track of those services and the amounts that you're spending. Then with reevaluation, we talked about this just a little bit, but for rapid rehousing, you have to do an annual reevaluation of program participants. So in order to continue receiving assistance, your reevaluation is going to have to show that the participant still lacks sufficient resources and support networks to retain housing without assistance. It'll have to show the amount and type of need that the participant still needs to regain stability in permanent housing. And then you'll want to show that the income, participant's income is less than or equal to 30% of the area median income. So the this is where we're talking about at reevaluation is when you really want to make sure that the income is less than or equal to 30% of the AMI. And then finally, termination documentation, you're going to want to keep that in your file too if it's applicable. So if the participant is terminated, you'll want to contain you'll want the file to contain documentation demonstrating that you followed written procedures for terminating assistance. Okay. And then lastly, we'll talk a little bit about financial record keeping. So in terms of financial records, you want to keep documentation showing that the grant funds were spent on allowable costs in accordance with the requirements for eligible activities. So this will help, this is going to help you ensure that you get reimbursed for all of your eligible costs. So in order to do it, you'll want to track the eligible costs and keep backup documentations, things like receipts. And then, okay, the recipient, the county, is actually the one that's obligated to make the quarterly reports, but they're going to be looking to you guys for documentation in order to make those reports. So, and this will include service data, which I believe is going to be pulled directly from HMIS, but it also includes financial data, and that's what they're going to need to get from you. So you'll want to just keep track of what you're spending, keep track of the backup documentation, and be ready to provide it to the county when they need it to report. And just to note, I think most programs have their own accounting tools, but we also at Homebase have developed a tracking tool that might prove to be useful. And if there's interest, we could show that to you guys, not today, but we could share it and maybe do another training if there's interest. But otherwise, mainly, however you track your expenses, just you want to make sure you keep it up to date and ready to submit on a quarterly basis. And then I just have a note here that if your expenditures are being paid from more than one source, so if you're getting funds from, if you're using ESG-CV, but also using, like, say, county general funds, just make sure that the split costs are accurately tracked in your accounting system. And then just a couple notes on timekeeping. So if you're using ESG program funds to pay for staff salaries, you want to be able to provide documentation that the staff worked the stated number of hours on the project and that the time was spent on eligible activities. So HUD does emphasize that there is no one right way to document your time. You can use either paper or electronic systems, but regardless of the system you're using, you'll want to obtain basic information, including the dates that the employee worked, the number of hours they worked, and then the specific project and eligible cost that the employee worked these hours on. Okay. And then just a couple of points to keep in mind about time and activity reports. You want to make sure that you're putting in actual hour increments and not just using estimates of time. So, the actual hours, like 4 hours or 3.5 hours that the employee worked. And then when staff salaries are shared among more than one budget line, so if they're doing street outreach and emergency shelter, you want to reflect the distribution of time between budget lines. And then also you want to make sure, or best practice, I guess, is that the reports are reviewed and signed. And we also have, Homebase has some tracking tools for timekeeping as well. So if that's of interest to anyone, you can just reach out and let us know. Are there any questions at this point? And actually, are there any questions on anything at this point? That's kind of the end of our presentation, but we definitely want to answer any questions that you might have. And then there was another thing I think we wanted to talk about. If there's anything that's you've seen here that you've been thinking about, you'll want your staff to be able to do, and you could use some support in training your staff. We'd love to hear about that as well.
I guess one thing I'm wondering is are these funds all being rolled out at the same time across the country? And is there any kind of forum happening to discuss, like, among different communities, like how funds are being used and what it's looking like, and that kind of thing?
Go ahead,
There
Nora.
are, so yes and no is always a fun answer. So yeah, there's a bunch of there's a bunch of money that comes straight from the feds, ESG-CV funds that came straight from the feds, and then there's some of the CV funds get funneled through the state. So folks that are receiving it through the state for round 1 and round 2 are sort of on track, although there's some differences. Like, we work with a bunch of different communities that are all dealing with these pools of funding, and the timing is a little bit different for everybody. I think HCD at one time was having office hours and opportunities for asking questions related to this. But, and then actually Homebase holds like a peer communities event and some other, we have also like a Bay Area COVID call where I think sometimes this is addressed as a topic. But I would definitely encourage you, if you have a specific question of like, oh, how do most communities do X, Y, or Z? Definitely reach out to us and we can provide you with some kind of examples of what you're looking for.
Thanks, Nora.
Yep. The other thing I would just add, because I know I've done this training a lot with a lot of different communities, and it can be really dry. And I feel like, at least to me, a lot of the requirements are fairly overwhelming. And I will say a good way that helps me think about this information is you really just want to make sure, right, that you're serving eligible clients and carrying out eligible activities, and that you're able to document all of that. So if someone comes in and audits you, you're not putting your funding at risk, right? So I think the more you can lay out this information in a way that's super easy for an auditor to read and easy to find, and like even with the financial record keeping stuff, like when we carry out audits, what we'll do is we'll look at like the general ledger for the program, and we'll just see, was all the money spent on eligible activities? And is there backup documentation that shows that that money was actually spent? And can we tie staff keeping time to and then we'll total everything out to what was ultimately drawn down on the grant. So just to give you kind of a big picture frame of reference, I think that's kind of what you want to be keeping in mind. And the last thing I'll say, and then I'll stop talking, is we do have like templates for all of these things, right? So like even for category 1, we have like a little checklist that you can walk through that prompts you to be like, this is the document you need. Like, this is a sample of what that document could look like. So I think we're going to do some work with Carrie to see if that will align with what this community programs want and need. And then hopefully we'll have that available for you too.
Thanks, Nora. Yeah, I did forget to mention as we were going through the documentation for category 1, we do have some template. We have templates for most anything we've talked about today. So yeah, here's our email address, Marin at Homebase. If you just send an email to that address, that'll reach me and Nora. And a few others. So definitely feel free to reach out if you have any questions.
Yeah, and I just really want to emphasize, like, we've contracted with Homebase to provide pretty in-depth assistance on this, especially for those of you who haven't had to deal with ESG funds before. So like, absolutely feel free to reach out to them. We're asking them to sort of check in with you early in the program and just sort of, take a look at all the stuff that you're, at your timesheets and your record keeping, and just make sure everything looks good so that if there are any things, that aren't, if in some way it's not meeting the requirements, that we're discovering that at the beginning and not like 5 months in, or not when you've spent a whole bunch of money and then come to the county and we go, oh no, we can't pay you. So we really want to we want you to feel really comfortable asking them, like, even if it's something that seems really like, does it matter, what format my dates are in? One person did them all in European format. Is that going to be an issue? Like, however tiny it is, like, please feel free to ask them.
Definitely. Just to reemphasize, we're here to answer your questions, big or small. Okay, well, that's all I have. That's all we have. So unless there are no more questions, I'll thank you all for joining us today, and got our email address. If you lose the email address, Carrie's got it. Yeah, thank you all for being here.
Thank you.
Thanks.
Thank you.
Thank you.
Yeah, thank you. Take care.
Bye-bye.